Bismillahir Rahmanir Rahim. Welcome to Derma Immunology. I'm Naglaa Elmongy, Professor of Dermatology, Cairo University. And my video today will be about the role of vitamin D in recurrent aphthous stomatitis. It will be a short but important video. Recurrent aphthous stomatitis is the most frequent type of lesion affecting the oral mucosa, showing a prevalence rate ranging between 5% and 66%. The diagnosis of recurrent aphthous stomatitis involves the exclusion of other potential reasons for stomatitis. Morphologically, recurrent aphthous stomatitis is classified into three types: minor, major, and herpetiform. The most prevalent form of recurrent aphthous stomatitis is the minor form, which constitute about 85% of cases. And this minor form heals without scarring, in contrast to the major variant of recurrent aphthous stomatitis, which is characterized by lesions that are more extensive and exceed 10 mm in diameter, with a healing that often results in scarring. The herpetic variant is characterized by multiple deep lesions and uneven borders. While the underlying causes of recurrent aphthous stomatitis are unclear, studies suggest that systemic factors like genetics, immunological, and hematological abnormalities, alongside other variables such as trauma, smoking, stress, nutritional deficiencies, and allergies, may contribute to its development. Prior studies have frequently connected recurrent aphthous stomatitis with deficiencies in multiple vitamins, including hematinic deficiencies like vitamin B12, folic acid, and iron. These triggering factors induce the release of pro-inflammatory cytokines through the infiltration of leukocytes targeting a particular area of the oral mucosa, which varies depending on the extent and severity of the disease. Hydroxyvitamin D, commonly referred to as vitamin D, is a fat-soluble vitamin produced mainly in the skin when exposed to sunlight. But it can be also acquired from specific foods and supplements. A deficiency in vitamin D is a global issue that may arise from many factors, including inadequate exposure to sunlight, limited access to vitamin D sources, or the use of certain medications like glucocorticoids, antiretroviral drugs, or anticonvulsants. Vitamin D receptors are found in numerous body tissues, and a deficiency in 25-hydroxyvitamin D has been linked to a range of health issues such as musculoskeletal disorders, metabolic autoimmune conditions, respiratory, cardiovascular problems, cancer, psychiatric disorders, chronic pain, and hypothyroidism. While the 1,25-dihydroxyvitamin D3, the active form of vitamin D3, plays a vital role in the metabolism of calcium and bone health, it also has the ability to regulate both the innate and adaptive immune systems. Vitamin D has the ability to modulate the immune and inflammatory reactions. Cells within both the innate and adaptive immune systems, including macrophages, T cells, B cells, and dendritic cells, express vitamin D receptors and participate in the synthesis and response to vitamin D. Recent studies have discussed the involvement of vitamin D in the occurrence of recurrent aphthous stomatitis, investigating the possible link between vitamin D deficiency and recurrent aphthous stomatitis episodes. Here's a study that was published in Frontiers in Nutrition, June 2023. Its title is Vitamin D Deficiency and the Risk of Recurrent Aphthous Stomatitis, Updated Meta-Analysis with Trial Sequential Analysis. In this study, PubMed, Scopus, Embase, and Web of Science were comprehensively searched on December 1st, 2022 to extract all relevant studies. All case control studies on the association between vitamin D and recurrent aphthous stomatitis were considered. A total of 14 case control studies with 1,468 subjects, including 721 patients with recurrent aphthous stomatitis and 747 controls were included. The pooled data showed a significant association between low serum levels of vitamin D and the risk of recurrent aphthous stomatitis. This study concluded that vitamin D deficiency could play a part in the development of recurrent aphthous stomatitis, suggesting the need to measure vitamin D levels in recurrent aphthous stomatitis patients, Also, the findings indicate the potential benefit of incorporating vitamin D supplementation in the treatment regimen for recurrent aphthous stomatitis patients who have insufficient serum vitamin D levels. Here is another study that was published in online on October 2023 with the title Serum Level of Vitamin D in Patients with Recurrent Aphthous Stomatitis, a Systematic Review and Meta-Analysis of Case Control Studies. In this study, a systematic search for evidence concerning recurrent aphthous stomatitis and vitamin D was conducted up to January 2020 across multiple databases, for example, PubMed, Cochrane Library for Systemic Reviews, Web of Science, Scopus, Embase. The meta-analysis included 8 studies comparing 383 healthy individuals and 352 patients with recurrent aphthous stomatitis. This study found that patients with recurrent aphthous stomatitis had significantly lower levels of serum vitamin D. And while the findings of this study showed that patients with recurrent aphthous stomatitis had significantly lower serum vitamin D levels, there was no significant link between vitamin D deficiency and the number of ulcer episodes in recurrent aphthous stomatitis patients. Recurrent aphthous stomatitis is a distressing condition that can severely affect eating, speaking, and maintaining oral hygiene. Its recurrent and severe relapses can considerably lower the individual's quality of life. The precise origin of recurrent aphthous stomatitis remains largely unknown. The findings of these studies are consistent with numerous prior studies that have shown low vitamin D levels in various autoimmune disorders, including rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis, type 1 diabetes, inflammatory bowel disease, and psoriasis. The impact of vitamin D on recurrent aphthous stomatitis remains unclear. However, both vitamin D receptor and the enzyme responsible for activating vitamin D, 1-alpha hydroxylase, are present in various immune cells, including T cells, macrophages, dendritic cells, as well as the oral mucosal epithelial cells. In patients with recurrent aphthous stomatitis, low vitamin D levels have been linked to the presence of pro-inflammatory cytokines released from T helper cells. Vitamin D has significant immunomodulatory effects, adjusting the immune system responses. Also, deficiency in vitamin D has been confirmed in diseases associated with recurrent aphthous stomatitis, such as Behçet's syndrome and what's called PFAPA or syndrome, or periodic fever, aphthous stomatitis, pharyngitis, and cervical adenitis syndrome, where the recurrent aphthous stomatitis is the primary symptom. As a conclusion, a connection has been established between low serum vitamin D levels and recurrent aphthous stomatitis. Consequently, evaluating vitamin D levels in patients suffering from recurrent aphthous stomatitis could be beneficial. Lastly, I hope that you have enjoyed this short video, and I'm reminding you again to subscribe to the channel and activating the alarming bell so that you can be updated with any new video, and thank you.